My name is Michelle Morris. Um, for many years, I was a consultant speech and language therapist working in the NHS. And in that capacity, I started the language and communication pathway that was originally the pathway for one particular locality in Greater Manchester, Salford. 2018, I was asked to lead this across Greater Manchester, and that's what I've done since. So it's been a while in its development, and each year we try and iterate and make it a kind of more mature pathway. So my background, as I said, is speech and language therapy, and I have an unusual background in that I also have qualifications in public health, and so I look at language and communication needs not from an individual perspective, but from a population health perspective. And that population health can be either a school or setting, or it can be a community, or it can be a city locality, as we call them in Greater Manchester. I lead on this pathway in terms of its strategic positioning and development. And I support locality leads from each of the 10 localities. We have a health and an early years practitioner lead, so that we have that kind of multi-professional dimension to the approach. So I particularly like this slide. It's a relatively recent one, as you can see from the date, 2023, but I think this really sums up the approach that we take in Greater Manchester to early language and communication. And this slide describes what's called a bioecological slide. And a bioecological approach is one that looks at the kind of biological factors of a child and in relation to their language and communication, but it then really considers those factors in relation to their ecology, i.e. where they sit in terms of their society, in terms of their support setting, their family, etc., etc. And that's really kind of the approach that we take in terms of moving away from that medical model of delivery and thinking about how we can influence and support language and communication in that very much wider context. So some of my concerns, I suppose, understanding the neurological importance of development in the 0 to 5 period is something that is really important. And actually, I don't think most people really get how important it is. They know that babies learn quickly, but actually that period of neural effervescence is so significant that it almost feels from certainly from a language and communication perspective, if you don't get good intervention in that period, it is so much harder to do further upstream, so much harder. And a basic understanding. And when I do training for lots of different groups of people, and I always include something on basic neurological development in infants, because actually people are fascinated by it. And just that simple understanding kind of drives the momentum and impetus to develop really effective interventions in the early years. And I guess if more people understood that, as a society, we'd kind of take a very different view on where we focus our energies. And I will talk later about certainly in health services, about where the focus is. But actually, that 0 to 5 period, we talk about it being a priority area, but it doesn't ever feel it attracts the investment that it really deserves. So I also think we need to take a more upstream approach to nurturing children. And that probably means actually starting with understanding that neurology, understanding that importance of nurture before children are even considered. Sort of understanding, for young adults are very into the kind of the concept of their own socialization and their own interaction with their peers, but actually understanding that from a baby point of view is not only really interesting, but actually they can almost see the kind of parallels in terms of how the brain is stimulated. So I think it's terribly important that we almost build nurturing into our curriculum in schools. The other message I would give, and I think this is, I think it's really sad, and somebody came out from one of the government departments, I won't point any fingers, And they were talking about COVID and about the impact on children in the past tense. And I had to stop them and say, the reality is that COVID is not over. COVID is affecting a whole generation of children. And the implications of that are still very, very significant indeed. And the impact that's had actually on their parents is very significant indeed. And I think it's no coincidence that the massive anxieties around special educational needs and disability, the SEND agenda, are driven by that parental anxiety that built up during COVID when children were not able to access services and support. So COVID is not over, and we need to be mindful when we're considering strategy that actually we take into account those children and young people who have suffered particularly as a result of the of COVID, and bearing in mind that the impact of COVID most definitely followed an inequalities agenda. So it was definitely a gradient, a social gradient. The children who came from the most financially challenged communities were the ones who suffered most from COVID. So the next point is, and I think this is a really quite a quick win, is that there's a massive gap in the joined upness of national strategies. And so often different parts of the system are governed by different and competing priorities. And actually aligning those things through some sort of collectivism around early years and early childhood would be, I think, quite a quick win. Joint commissioning and delivery is vital to bringing about meaningful change in the early years agenda for speech, language and communication, but for many other things as well. But actually, where you get joint commissioning, where everybody's invested in commissioning services for children and young people, then you get it kind of automatically buys buy-in, and it automatically drives cooperative delivery of services, because there's investment from different aspects of the local system in it. So the other thing which I think is terrifically significant, and I know is a massive concern to all early years providers, and that is the recruitment and retention issues of early years practitioners. And so with the expansion of the early years entitlement and with the churn of staff, it makes it incredibly difficult for early years settings, even with the best will in the world, to deliver effective care to children in their environments, because there is a constant turnover of staff, and training may be delivered, but if those staff are only in post for 3 months, then their skills and knowledge is lost very quickly. On a much smaller scale, but equally important in my mind, is the recruitment and retention issues in children's speech and language therapy. Now, some work we've done in Greater Manchester has showed us that the retention aspect is particularly important. And what we know is in Greater Manchester in the last 2 years, that 47% of speech and language therapists who left NHS posts went into either the private sector or left the profession altogether. So there is a massive crisis in retention. We are training speech and language therapists, and they are hemorrhaging out of the NHS. And we need to do something very specific and very nuanced that addresses these issues in the SLT workforce. The next item is something that came up in both the original Burko review in 2008 and then the subsequent Burko refresh, and that is there is insufficient focus on child development in teacher training, and teachers have almost no understanding about child development, irrespective of whether that's language and communication or other things. But just getting some I don't know how the curriculum seems to have veered away so much from actually the nuts and bolts of how children develop, but it seems to have done. And if we could address those issues at a teacher training level, then I think we are going to start the process of being able to build an understanding of child development and how that impacts on learning at a much earlier stage. to continue the list of concerns, I think from a GM perspective, and certainly speaking to colleagues in other parts of the country, there's a great deal of frustration in the fact that national initiatives are often parachuted into areas without there being any understanding of what's going on at a local level.
Yeah.
And so you get this level of duplication and project fatigue. And sometimes people just don't know whether they're coming or going because there's so many different projects in an area. And actually coordinating with what is going on and then adding value to what's going on locally would be a much better approach to nationally funded initiatives. And there isn't enough money to go around locally. So actually using some of that money that has been made available nationally to support what is going on would be incredibly useful. And it's so frustrating to see things duplicated. And that kind of links to the next point, which is the lack of recognition that local areas may have the solutions. And they, as I said before, localities understand their populations, and they may well have the solutions. They may just not have the resource to deliver those solutions. So a better understanding of what is required, I think, it would give a more nuanced and more cost-effective intervention. And then my final 2 points are probably linked to health provision. And that is more generally, I think, that children's good health provision, as opposed to ill health provision, is often overshadowed by the needs of the adult and acute sectors. So in terms of health planning for children, children are almost seen like a disease group, which is rather unsatisfactory. So you'll have stroke care and you'll have dementia care and you'll have children. Well, children are not a disease group, and actually the issues that affect children's health are many and nuanced. And yeah, the priority, I think, is, they are 20% of the population, but they don't consume 20% of the NHS resource. And I think the same applies then to health providers. So actually, therapists and other professionals who are providing health-related care, but providing it into other sectors, they often find it very difficult that the work that they are trying to deliver is not seen by the NHS providers as because the providers are used to a medical model of delivery, and kind of understanding the requirements to provide this bioecological model is really quite alien.